It's a pretty big decision. If it's overturned, we're looking at about 9 million more Americans without health insurance. And that means premature death, that means unnecessary suffering. It means people can't afford to buy in to these exchanges so they can have health insurance. What this means for 9 million Americans, if they lose access to health insurance, means that they'll go without meals, they'll go without paying the electricity bills, they'll go without buying clothes for their kids because they have to spend more and more money out of pocket to pay for health care that should have been covered by the exchanges in this case, and by what we're saying, by a national health insurance, single-payer healthcare system.
Nurses, as you know, are on the front line of healthcare, so we see firsthand what it means when people have access to insurance and what it means when people do not. And what it means when they do not is that they don't get wellness care to prevent illnesses, and when they have a problem, they actually end up delaying care.
I think step one, they ought to make good on the original Keep Your Plan promise and bring back those plans that Obamacare canceled. But I also think they need to create a lot more flexibility, and they need to create an alternative model for states where they can really give people a lot more choices and a lot more opportunity to figure out what works for them and their families, and not to be locked into these one-size-fits-all Obamacare policies.
I went a couple of months without health care. I'm a 3-time breast cancer survivor. That makes me, in 2013, I was uninsurable. When my COBRA insurance ran out, I just had to go without care for a period of time. I actually skipped a 6-month cancer checkup because I was afraid, what if something happens, I'm going to go bankrupt. It'll make an impact on my life, but I luckily have some savings. I'm 59. I can tap into my retirement. It means life will be harder if I live, into my 80s. But the people who don't have any savings right now to be able to pay for those premiums, they're the ones I'm really, truly worried about. You'll have sicker people, and it will cost more if they end up in an emergency room. People will die if they don't have their insurance and don't have care.
Once Obamacare is gone and government health care is gone, the insurance companies will be forced to compete with each other, and the health care costs will go down, and it's better for everybody involved. There's more people that's going to be hurt by this law than those that are hurt by not having the mandated health care now.